I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm going to start with our Department of Emergency Manager, Director. Yes, I can.
Okay, great. Thank you. Good morning, everyone. This is Scott Lewis. I'm actually telephoning the command post, which is located at Emergency Management. Today, we're going to discuss briefly and give you an overview of the COVID-19 response for Nye County. Our county government is operating, and it's very important for everyone to understand.
Losing you, Scott. Can't hear you.
It's very important for everyone to understand that our county government is operating. We're operating in a different fashion than we are normally used to. We are doing things mostly from a remote location, and the reasons for that is that we have embraced the social distancing messages that have been relayed to us both through our federal and state partners, including the governor. The Emergency Operations Center is open under a partial status. What that means for us is that we are monitoring and manning the EOC from 8 a.m. to 6 p.m. Every day of the week. We're also normally have the Operations Center would have most of our leaders assembled in one location, so we would have the ability to have immediate decision-making capability. But given the social distancing aspects, our EOC is limited to just an immediate crew. Therefore, we are utilizing telecommunications and other means in order to get our messaging out. This is something that most EOCs throughout the state are embracing. This is not an anomaly, but it is an anomaly as far as the overall approach to Emergency Operations Center's usage. For our purposes of our conversation today, we've developed operational objectives, and the operational objectives in this particular are effective incident command structure, effective accountability, appropriate medical supply resource chains, effective EMS transportation plans, appropriate support to COVID prevention. We're also essential in developing and maintaining a comprehensive medical plan with PPE requirements reinforcing federal, state, county policies and guidelines. Essentially, what our emphasis is on is supporting health and safety of all Nye County emergency responders and support of minimal disruption to county government, employees, schools, and essentially our citizens. We have divided the event into several categories. The categories include preparedness, prevention, resources, and response. As a snapshot, just before this meeting began, we were notified through our health officer that there's one additional confirmation. The confirmation came from a Las Vegas-based hospital through our state contacts to our health officer and then to DEM. So as we speak, there are currently 5 active cases for Pahrump. There are 0 deaths that we're aware of. There are 2 recovered, 1 in Beatty and also 1 in Pahrump. So that leaves a total of exposures of 7 that we're aware of at this moment in time in Nye County. One of the things that we first had to consider in embracing our plan is what is called a COOP plan, which is the Continuity of Operations Plan. We have identified a continuity operations plan for each department throughout the county. We have also identified a multi-tier staffing model for key positions within the county government, and you will hear much about the COOP plan as we run through the remainder of the report. And essentially what the COOP plan is doing is, so if our normal operations, whether they include facilities, staffing, apparatus, anything along those lines, that we've built it not only just 1 deep, but several layers deep, so that in the event that maybe one of us becomes sick, there's someone who immediately is recognized and can step up, and they're aware of the plan and its objectives and can step in and maintain that. Under preparedness, our supply and resource chains are in effect. The supplies have come from numerous stockpiles, both federal, state, and also Nye County stockpiles. We've also reached out to our community partners and private groups who have also helped us attain some medical supplies. All these supplies are being distributed to all of our emergency responders throughout Nye County. This includes fire, EMS, and the Sheriff's Office. We have also made PPE available to other Nye County agencies such as the Public Administrator, Sheriff's Auxiliary, the Detention Center, and Buildings and Grounds. The goal is to make sure that all of our people are protected to the best of our abilities and gives them the best opportunity to serve our citizens. The necessary supplies include, but are not limited to, gloves, N95 masks, gowns, eye protection, Tyvek suits, sheets, and surgical masks. Under preparedness also is very important for us to understand the essential aspect of communications. There's both internal and external communications that we're delving into. Our internal include the teleconferences, much like we're using right now in order to talk to our citizens. We have emails, text, instant messaging. On the radio sides, we're still utilizing our 800, our VHF trunking, our VHF conventional channels, as well as our cell phones. We also have the availability in some kind of infrastructure loss of using satellite phones and other Aries Races groups that are manning the EOC and stepping up and making sure that we're covered throughout the county. We are also doing daily reports, both internal and external. Those reports address what currently we're experiencing globally, nationally, state, and local. We're also addressing different issues as far as what the availability of PPE is and what our resource and our response modes look like. Other externals are public releases that are completed daily through our Public Information Officer, Arnold Knightley. He's done an outstanding job in getting different media platforms filled with information, whether it's social media, written, print, radio, and television. We also have daily briefings with our school district. We are regularly on the radio. We are regularly on the television. We're clearly on social media. There's PIAs that are made available to the public. And daily food availability was a resource that was through the Sheriff's Office Facebook. It's become highly popular in identifying where people can obtain food and paper products and what the availability is on those within our respective stores. Facilities. We're having a number of issues with facilities that we've worked through. We've identified secondary facilities that can serve for temporary testing pods, which have been organized in Pahrump, Beatty, and Tonopah. We've also had approximately 200 tests completed in those pods at this point. Additional testing will be done in a second tier, which is to be done next week. Information has been distributed on the Nye County Sheriff's Facebook and also through our Public Information Officer. But the second tier will include stops in Pahrump, Amargosa, Beatty, Tonopah, and Round Mountain, and that's all next week. We have identified existing county facilities that can also serve as surge protection for medical-related issues. What that means is if we were to have a significant influx on patients coming into local facilities, we have the ability to manage some of those off-site, given the same level of medical protection. We have also opened strategic plans for mass fatality should it ever be necessary. We don't anticipate it, but we are prepared for it. The surge protection includes treatment isolation, EMS cots, treatment beds, medical support systems, oxygen, x-ray, etc. The possibility of additional temporary structures include match-style tents, triage temporary structures, mobile command posts, and mobile mortuaries. They are all part of our ongoing plans, and we have contingencies in place to cover each and every one of those. Our clinics, or local clinics for testing and potential surge, include our doctor's offices. All have been extremely cooperative in an overall effort to make sure that our citizens are protected and cared for. One of the best things we can do is utilize existing residences for quarantine purposes, following the guidelines of up to 14 days for self-quarantine for anyone who has signs and symptoms. For those cases that appear to be worsening, there's a medical plan that's placed so that they can preside or be provided the necessary care by our medical providers, and whether a hospitalization at the last resort is necessary or not. Our food supply chain, we have a food supply liaison group that has met on several occasions. They've done an outstanding job in helping manage the food distribution with special considerations for our senior citizens and our special needs folks. Through the Facebook on Nye County Sheriff's Office again, they've identified where food products or paper supplies might be per store. That's done on a regular basis. And so if you check on that Facebook, that'll give you where you can buy those type of items, whether it be meat, dairy, paper towels, all those different things, who has the greatest supply, and they're all cooperating together in getting that information out. They've also identified specific days and hours for our senior citizens and our special needs to shop and that way it eliminates some of the additional stressors of those folks trying to get their essentials. They're also utilizing an ID approach and social distancing, so trying to manage the influx of people to make sure that everybody's safe during the process. A very popular approach also is in our prevention messaging. We're utilizing the social distancing of greater than 6 feet. We recognize that is an essential or a paramount piece. Our messaging on that is out there is stay home for Nevada, stay home for Nye, stay informed through nyecounty.net. These are county messages to help protect our citizens. We have placed these to electronic display boards, both mobile and fixed. Some display boards, some of the larger ones, some of the casinos we tried to, but they're managed by third-party vendors and have been shut down, and those companies are not available to change the messaging. We've also utilized static boards, social media, radio, TV, and print. And through the aforementioned tools, we've been able to get the message out, and we're starting to see the improvements on our roads. We're starting to see less people out and about. We're starting to see less people out in the parks. We're not seeing the congregate styles that we normally would. And the Sheriff's Office is out there patrolling and making sure that we remind our citizens to maintain those parameters. We're utilizing sanitizing hand washing messages and don't touch your face with unclean hands. The county is, again, is at the forefront and operating remotely to help ensure protection to our citizens and employees. Our resources, we have a good, solid resource chain underway. It was not as much so in the very beginning. It's getting better. However, there are still some gaps that we're working on. The resource requests are going through state DEM, and they are then channeling through FEMA, the state, and utilizing even private vendors throughout the state, including our mines, which have absolutely sent some material down to us and been distributed to emergency responders. We're utilizing the gloves, the N95 masks, surgical masks, eye protection, face shields, goggles, gowns, and sheets. We also have our stockpile of respirators, both filtered and our self-contained breathing apparatus, both brands of Scott and MSA, that are located throughout the county should they be necessary to be stockpiled in any one given area. We are using our hazmat resources. They've been distributed in Pahrump, Beatty, and Tonopah, so they could be deployed immediately should it become necessary. The state health surge trailers are located in Pahrump, Beatty, and Tonopah, and they're also available for quick access. Our leadership group has assembled and is engaged in a daily conference and other regular conference threads to discuss current and immediate needs. Our liaison groups have been established and are interacting on a weekly basis and are available to us should that need to increase. The liaisons include Valley Electric, the water utilities, sanitation, our state assemblymen, and also the sheriff and the DEM/fire chief. Our responses, all emergency services throughout the county are up and running. They're fully staffed and fully committed. They have the necessary PPE to complete their missions. The call volume is actually lower on the EMS side of the house due to the stay-at-home messages. However, serious incidents that have occurred throughout the county, including several fatal accidents recently. We had a fatal house fire. We had a deputy who was shot. All those were managed without incident. They were completed in a timely fashion. And all resources, again, it was very, very important for everyone to recognize, is committed to our citizens, and they're up and operating.